Hi, this is Dr. Beyer. I want to give another case study of a patient who had a real successful outcome with a functional medicine approach for the thyroid condition that she had. This particular patient was a 65-year-old female who had been experiencing really deep-seated fatigue, a need for an excessive amount of sleep, along with GI symptoms of irritable bowel syndrome, alternating diarrhea, constipation, a lot of overall joint pain. In fact, had been worked up with previous doctors for different autoimmune conditions, and a lot of brain fog, a lot of mental fatigue. She actually had been on Synthroid, thyroid hormone medication for about 8 years, but pretty much the whole time hadn't really experienced any improvement in the symptoms. And in the year previous to coming to see me, the fatigue particularly had gotten especially bad. So the fatigue had been there for a number of years, never really improved on thyroid medication, and in the year previous to seeing me, the fatigue in particular had gotten especially bad. And so she presented for treatment with me, and we did some laboratory evaluation, some blood chemistry evaluation, and found a number of different things. In particular, we found that she had an autoimmune thyroid condition, and that particular condition, which is called Hashimoto's, is not very well treated with thyroid hormone medication, because the thyroid hormone, and it doesn't really matter what kind it is, whether it be Synthroid or Armor, whether it be synthetic or natural or a T4 or T3 combination, it really doesn't matter very much in most people with Hashimoto's what type of hormone medication it is, because the hormone doesn't address the underlying immune system dysfunction. And that's the primary thing that she had in her particular case. Her blood work showed some other things also, like the liver enzymes were elevated, not indicating any kind of tumor or cancer of the liver, but definitely some functional disorder of the liver, indicating she's not clearing toxins out of her system very well. She had an anemia, and she had some other irregularities on the blood test that warranted doing some salivary hormone testing, which subsequently showed very low cortisol levels as well as progesterone levels. Particularly the cortisol levels were especially low on the salivary hormone test. So we began doing a functional medicine approach with her, and seeing her once a week, coming into the office, and within 2 months of undergoing some functional medicine protocols that included some dietary changes. We also needed to do, because she had the autoimmune condition, some food sensitivity testing, which is always warranted in Hashimoto's or any autoimmune condition, because all the studies have shown that with autoimmune conditions there's a real high likelihood of there being a permeability issue within the lining of the gut with subsequent immune reactions to foods, and that's one of the things that stresses the immune system with Hashimoto's. And so we did the appropriate food sensitivity testing. Interestingly enough, she showed up positive to not only gluten, which is pretty common, but a number of gluten-free grains, which is interesting because I have a certain percentage of patients who either suspect or know that they're gluten sensitive, and so they adopt a gluten-free diet and don't really feel that much better, maybe a little bit, but not too much better. And oftentimes when that's the case, it's because they're also reacting to some grains that are gluten-free grains. So they're eating gluten-free breads and pastas and so forth, made with grains like tapioca flour or potato flour or rice flour or just different gluten-free grains. And sometimes they're reacting to those grains, the immune system is. So we do very specific food sensitivity testing, and with this particular patient, as well as all my patients, we really fine-tune and narrow down the diet to exactly what can and cannot be eaten. We did some other testing, like I said, salivary hormone testing, and corrected those hormone imbalances. And within 2 months, so this is a woman who's suffering a number of years, I think 8 or 9 years was about this time frame that she had symptoms, and really, really increasing within the last year. And within 2 months of treatment, her fatigue improved 90%, her irritable bowel syndrome symptoms 90%, the diarrhea was pretty much gone, just maybe a little bit of gas here and there, but 90% improvement with the GI symptoms. The joint pain also improved 95%. The brain fog improved 90%. So this is a good example of, honestly, a typical patient response. When we are able to specifically identify exactly what's going on and then address those issues, people get these kind of results. They get life-changing results, to be honest with you. So there's just no need to suffer. If you're watching this and have been considering coming in and getting evaluated, don't hesitate anymore. You could be like this lady and get those kind of results within a few months and really get your life back.